Hi everybody, this is Group 6 and our program focus is on gestational diabetes. The goal of our program is to decrease the rate of gestational diabetes in low-income, first-time pregnant women between the ages of 16 and 24 in San Diego County. The purpose of this intervention is to prevent first-time mothers from contracting gestational diabetes. Some preventative measures to be used in our program include educational materials, one-on-one and group nutrition sessions, glucose testing, and exercise guides. We have focused on San Diego County because Latina women have a higher risk of contracting gestational diabetes, and San Diego has a high concentration of this demographic. We chose this age group because younger women going through their first pregnancy may not have proper education when it comes to health and nutrition during pregnancy. Here are some of our SMART objectives. By the end of the intervention, more than 80% of the women in the intervention group will be aware of the nutritional guidelines and physical activities that should be practiced throughout pregnancy. By the end of the second trimester, the pregnant women in the intervention group will have completed 80% of the classes offered. And by the end of the program, 90% of newborns from women in the intervention group will be born without gestational diabetes. We have chosen to utilize the health belief model. Within this, we have perceived susceptibility, which is informing pregnant mothers the odds of contracting gestational diabetes. Perceived severity, which explains that gestational diabetes has a permanent effect on mother and child. From these, we have perceived threat, which is the risk of contracting gestational diabetes. For the health belief model, we have to take in consideration perceived barriers, which include cost, peer and cultural norms, as well as personal resources such as time. In order to achieve our main goal of preventing gestational diabetes in our target population, our cue to action is being a participant in our intervention. From these, we gain some benefits such as healthy pregnancy and postpartum for mother and child. We will be measuring our outcomes objectively through blood glucose testing and subjectively through a survey asking the participants questions such as, did you contract gestational diabetes during your pregnancy? The response to this question will be nominal. The second question we will ask is, do you feel this program helped you avoid contracting gestational diabetes? To which they can answer strongly agree, neutral, disagree, or strongly disagree. The response to this question is ordinal. Our research design is a randomized experimental design with pre-test and post-test to track results. Our experimental group will receive our full intervention, which will include educational classes, nutrition, and more. Our control group will not receive our intervention, but will receive the same tests and measurements as our experimental. This chart is an example of how we will recruit and determine if participants are eligible for our intervention. We hope to end up with at least 60 participants in each of our groups. We will follow the same timeline of monthly appointments based on the trimester of pregnancy and schedule for regular prenatal appointments and testing.